Well, good morning, everyone. I want to thank everyone for coming out for this briefing this morning. I'm proud to be joined today by elected leaders, county administrators, school officials, and first responders from throughout the Metro Richmond region. With us today, we have representatives from the city of Richmond, the counties of Henrico, Chesterfield, Hanover, and Goochland. I'm also thankful to have with us one of Virginia's leading public health officials, Dr. Danny Avula, head of the Richmond City and Henrico County Health Districts, to provide you and the residents of our region an update on our response to COVID-19 and reliable information so you can stay informed going forward. As you all know, Governor Northam yesterday declared a state of emergency in the Commonwealth of Virginia. And today we have gathered here united as a region to take similar actions. In light of the imminent potential threat to the public health and public safety, I am declaring a local state of emergency in the city of Richmond effective immediately. This state of emergency will coincide with a 30-day state of emergency declared by the governor of the Commonwealth of Virginia. These declarations will enable us, working in concert with the state government, to act swiftly and responsibly to marshal resources. And they will enable us to work collaboratively to address the needs of our communities as COVID-19 evolves in our region. To bring you up to date, already we have activated our regional incident management team of first responders to coordinate our efforts on the ground. We also have convened leadership from our surrounding jurisdictions to meet on a regular basis. These leaders have pledged to work together to share our resources and to participate in a supply chain that ensures all localities will have regional support they need to respond to the challenges of COVID-19 in their own backyards. To keep the public informed, there are several websites that we would appreciate you distributing through your news outlets. In the city of Richmond, the website is www.richmondgov.com/COVID-19. For the Centers for Disease Control, it's www.cdc.gov/coronavirus/2019. And for the Virginia Department of Health, we ask that you visit www.vdhvirginia.gov. While this infectious disease has yet to become prevalent in our region, we know that the numbers will grow. And we've already seen the examples of communities and countries that are being seriously challenged because they did not take the early steps to address community spread or realize the threat of COVID-19 poses until it already is on their doorsteps. The leaders of this region are choosing a different path. We choose to stand together and to be prepared and do everything in our power to minimize the impact it will have on the residents of our region. We know that the coronavirus knows no borders. It does not know what county it's in or what city it's in. We know that an ounce of prevention is worth a pound of cure. And we know that in order to meet this health challenge head on, we must plan together, prepare together, work together, and fight together to keep our people healthy and safe and to protect our local economies. That is why we have taken some important steps recently to minimize the potential for community spread by encouraging people to avoid large mass gatherings, practice social distancing, and follow common sense personal hygiene protocols. For the last couple days, I have spoken with business and Chamber of Commerce leaders and faith leaders and encouraged them to follow some similar guidance and to explore providing options to telework and liberal use of sick leave. And I know I speak for all the leaders here when I say we appreciate the steps taken by the business community, the faith community, and the numerous community partners throughout our region who had planned activities in the coming weeks and either postponed, canceled, or rescheduled their events. The leaders of our public school systems and higher education institutions should also be commended as well. They've taken steps to mitigate the potential for this disease to gain a foothold in our families and impact our most vulnerable populations. All recognize the seriousness of the potential threat posed by COVID-19. They did the right thing. We're all doing the right thing. They put public health above personal and organizational interests, and that is the spirit in which this group comes together today. So, ladies and gentlemen, at the end of the day, no matter where you live, the health and safety of our residents must be our highest priority. And I'm proud to stand here today with regional partners who know that the best way to protect our localities is to stand, albeit socially distanced, stand together as a region. I thank you for being here, and now I'd like to bring up Dan Schmitt, the Vice Chairman of the Henrico Board of Supervisors.
Thank you, Mr. Mayor. Good morning, everybody. On behalf of the Board of Supervisors and the administration of Henrico County, I appreciate the opportunity to be here with you all this morning. Henrico County stands in partnership with our neighbors, Chesterfield, Hanover, Goochland, and Richmond, and the Commonwealth in declaring a state of local emergency over the COVID-19 coronavirus. As you're aware, this outbreak is extremely serious and evolving quickly. In Henrico, we are monitoring the situation closely and are ready to do whatever is necessary to address whatever threats this pandemic poses. You're already seeing this in the difficult decision to close schools in order to ensure the safety of our children. Regionally, our efforts are being directed by the Central Virginia All Hazards Incident Management Team. These efforts extend through the tireless work of our first responders and public health workers. Let me just take one extra second and thank the members of this regional team, not just the outstanding efforts of Jackson Baynard and Danny Avula and the Henrico delegation, but of all the members from our partner jurisdictions who are once again proving the power of regional collaboration for the benefit and protection of our collective constituents. By declaring a state of local emergency and by working regionally, we will be ready to mobilize whatever resources are necessary. We also will be ready to tap additional resources from the state and federal governments. We understand this is an unusual, inconvenient, and perhaps frightening time, but it's critical that everyone remain calm, stay informed, and follow the CDC's safety recommendations. Henrico will continue to provide updates on our website, henrico.us, as well as on the Henrico County government accounts on Facebook and Twitter. As local officials, the greatest responsibility we collectively accept is to protect the health, safety, and general welfare of our residents. This is exactly what we are doing with our emergency declaration and our work as a region. At this time, I'd like to turn it over to my friend and colleague from Chesterfield County, Chairwoman Leslie Haley. Thank you.
Thank you, and hello and welcome, and I bring greetings also on behalf of the Chesterfield County Board of Supervisors. And thank you for giving me a few minutes to update what we too are joining in this collaborative partnership in Chesterfield. As we work with our partner localities to address this potential regional impact of COVID-19, Chesterfield also stands ready to act. Working with our counterparts to declare a local state of emergency is in the best interest of Chesterfield and of our entire region. As we move through this process, Chesterfield will continue to work collaboratively to monitor this evolving public health issue. Our number one priority is to make sure our residents, our businesses, and our visitors are aware of the latest information and the precautions they need to take. Last week, we developed a dedicated webpage at chesterfield.gov/coronavirus that provides current updates issued from our county, as well as links to resources and to find the most current information from the CDC and from the Virginia Department of Health. In addition to Chesterfield's dedicated response to COVID-19 webpage, I encourage our residents to follow Chesterfield's various social media accounts to stay informed as we work through with our regional partners to share reliable and regional information on a current and up-to-date basis. Chesterfield, as with our partner localities, is equally as committed to the health and safety of its employees and minimizing the risk of exposure and transmission of the viruses through the workplace. And therefore, we will continue to review precautionary measures such as restricting travel, rescheduling large events, and following other best practices. We're very well aware that we want our citizens to be able to maintain a lifestyle, and we recognize that there are certain citizen groups that are more at risk than other groups. We want our folks not to be engaged in an alarmist perspective, but a perspective of being well informed about the issues and the potential risks they face. And let us keep in mind that while the CDC and the Virginia Department of Health continue to emphasize the risk is low, there are these higher risk individuals and these special populations that seem to be at this greater risk, and we need to be very mindful of them on a continuing basis. These are particularly older adults and people at all ages with severe underlying health conditions. And the information that's out there, potentially on social media, that may start to get people a little bit anxious, let's hope and continue to direct our folks to the reliable information that all of these jurisdictions are committed to provide. We're encouraging our residents who are potentially in these at-risk populations to be particularly mindful and to seek services, including services that all of our localities are able to offer, to provide them not only guidance but assistance as needed. Chesterfield will continue to remain vigilant in this situation as it continues to evolve, and we know that we are particularly involved right now in a budget season, holding community meetings. We are doing everything we can to bring these meetings, live streaming them to you. Starting on Monday with our first public hearing in the evening, we will be running that on a Facebook Live for folks to be able to participate as well through online comments and questions. So we will continue to update and communicate that to our citizens. So we will continue to remain vigilant, and as this situation evolves, we will adapt, we will take precautions, we will communicate, we will attempt to meet the needs of our citizens on a daily and hourly basis. I so appreciate being here as part of this regional partnership and representing Chesterfield. This is a partnership that is serving our entire region so well, and with that, I want to turn this over to my friend and colleague, the Vice Chair of the Hanover Board, Mr. Davis.
Thank you, Leslie. I'll be brief. Thank you very much. Good morning. My name is Sean Davis, and I serve as the Vice Chairman of the Hanover County Board of Supervisors. Thank everyone for being here. Members of the media, thank you for helping us get this vital information to the public. On behalf of the board and the entire county administration, I am honored to be here to speak to our citizens, calm fears, but provide relevant information. I am also glad to be joined by our school superintendent, Dr. Michael Gill, and Chief Jethro Pyland with the Hanover County Fire and EMS. Likewise, I had an early morning meeting with Colonel Sheriff Hines this morning, and he is fully committed to maintaining the public safety of Hanover County. The health and safety of all residents is our primary concern. Therefore, it is important that Hanover County immediately declare a local state of emergency. We are joining with our regional partners to share our resources and coordinate our efforts. The health and safety of Hanover residents, as well as all of those in the Richmond region, is our primary concern. Hanover will be a committed partner in all regional and state efforts to serve our citizens of our county, the Richmond region, and our Commonwealth. Working together, we will aggressively combat this public health emergency, and in doing so, continue to serve our citizens at the highest level. Hanover will be a committed regional partner and a committed partner in all state efforts. We will work together as we combat this virus. This virus knows no boundaries, but we will work together to combat this public health safety emergency. I've been in touch with many folks in our public sector businesses, and we urge those folks, to the extent possible, to follow safe protocols. While we cannot mandate certain criteria, we do ask that large meetings of 250 or more be curtailed, again, to the extent possible, and that all folks recognize that pertinent information will come from reliable sources. That will include websites from your county governments and our regional partners. Thank you very much. My apologies. I do want to introduce my dear friend and colleague, longtime friend and colleague, Chairman Lascolette from Goochland. My sincere
Don't touch me. Good morning. I'm Susan Lascolette, Chair of the Goochland County Board of Supervisors. And on behalf of the Board of Supervisors and Administration of Goochland County, I appreciate the opportunity to be here today. Goochland County this morning, in conjunction with our regional partners and the Commonwealth, is declaring a state of local emergency in response to the continued spread of novel coronavirus or COVID-19. This action allows us to take additional steps as a region to dedicate resources and protect our communities. Working together as a region is our top priority to make sure our residents and our visitors stay safe and healthy. Goochland County will continue to review precautionary measures such as limiting employee travel, limiting large events, and indoor use of county facilities. Through continued preparation and collaboration between localities guided by the Central Virginia All Hazards Incident Management Team, we will continue to monitor this pandemic and support each other in our regional response. So thank you, and that's my honor to turn the podium back to Mayor Stoney.
Now I'd like to bring up Dr. Danny Avula, the head of the Richmond and Henrico health districts. Dr. Avula.
Thank you, Mayor Stoney. I really have been grateful for the leadership of our region over this last week. This has been an incredible amount of collaboration and humility and intelligence and just really decisive decision-making as a group. It's been really remarkable to be a part of it. As public health, we always try to provide the best guidance possible based on good data. The challenge that we have been facing as a state and as a nation is that our access to that data has been fairly limited because we've had really limited testing capacity. And as a result, we only have a partial picture of what's been going on with COVID-19 around the country. We only have a sense of just the degree to which it's moving in our communities. What we do know here in Virginia is that in just the matter of days, it has gone from 3 cases to 9 cases to 17 cases, and that will be even more today, as I know colleagues of mine are working up cases around the state as we speak. And I expect fully that these numbers will grow significantly as testing expands around the state. We also know that this is not the flu. There's no vaccine to COVID-19. There is no treatment outside of supportive care, no effective antiviral medications. And the early reports are showing that it is somewhere between 10 and 20 times more deadly than the flu across the globe. As we've watched the disease spread around the world, we have seen the epidemic curve, which is the normal bell curve that most infectious diseases generally follow. We've watched that curve in China and Korea and Italy, and we've seen that curve reach peaks that are completely stressing and overwhelming the healthcare systems and the healthcare infrastructures in those communities. We have got to figure out how to keep that at bay. Here in the Richmond region, we are blessed with a phenomenal healthcare infrastructure. We have 3 top-notch healthcare systems who are more than equipped to provide the kind of supportive care that is going to save lives here in the region. But if COVID-19 overwhelms the healthcare system, it's going to lead to many preventable deaths, not just from COVID-19, but from other causes, from folks who couldn't get in the hospital because the health system were overrun. While most of the folks who get COVID-19, 80% or so, are going to contract very mild disease, we do know that 15 to 20% of individuals with this disease will require some more acute intervention, and 5% really requires more intensive intervention like ventilation. So we have got to do everything we can to flatten that epidemic curve. We need to prevent that surge of disease that's going to overwhelm the healthcare system and stretch out the epidemic so that our healthcare infrastructure can keep up with the demands that it's currently and even more so going to face over the next days and weeks. And that is going to require some fairly drastic measures. Declaring a local emergency like you've heard today. we also are going to need to change the norms of our social interaction basically overnight because if we're going to minimize the transmission of virus. You know, all the messages you've been hearing about hand washing and face touching and handshaking and self-isolation. You know, I've engaged in more fist bumps and elbow bumps in the last week than I have in my entire life. But that's good. It's showing that this social change is happening fairly quickly. You have heard some very significant and well thought out decisions around school closure. You've heard a lot of talk about social distancing and the advisement by this region to cancel large gatherings of greater than 250 people. Those are all very significant steps, and they're the kind of steps that are going to be required to flatten this epidemic curve. And this part is crucial. These interventions need to be enacted early enough to make a difference. You've heard me say a lot over the course of this past 2 weeks that we don't know a lot of about this virus, that it's only been kind of 3 months as it's traversing the world over the last 3 months. But while we're still learning about COVID-19, we do know from our experience dealing with pandemics that the interventions that actually make a difference always need to be taken sooner than we think. And so that's what you're seeing here. You're seeing bold leadership by our region because to many in our community, these steps may not seem necessary right now. And so many times over the course of the last couple of weeks in our conversations, we've said we don't want to feed into the anxiety and the panic, and that's absolutely true. And I want you all to hear that these measures are not out of fear, but they are an act of prevention and compassion and preparation. Compassion particularly for the most vulnerable individuals of our community who are going to feel the brunt of this disease. As I've thought about this crisis, I've recognized that this is a remarkable opportunity for our entire community to rally around one another, to protect one another, and to love one another. Thank you.
Now we'll open it up to any questions for the region.
What effects does declaring a local, this for the localities, declaring a local state of emergency have, considering the state is already under a state of emergency? What are the effects there?
Well, it gives our locality some flexibility in terms of procurement, a number of other operational abilities as well. You know, in these sort of times, you need that flexibility, and it allows us to be a little bit more nimble in a time where this is a time of crisis and emergency. So I think each locality, I know the city of Richmond does, we need to have that as we continue to plan and get in front of this disease. And so you know, we appreciate the governor on what he did yesterday, and I think that each of our localities are acting out of what we believe is a need right here in the moment.
I know you all mentioning limiting travel, teleworking for county employees, but what about for the ones who are still going to have to be engaging day-to-day, like the fire department and police officers? What sort of policies are being put in place for those workers?
We'll take any fire. Sure.
Good morning. Loy Center, Fire and EMS Chief in Chesterfield County. Back as far as January 27th, we put in place some protocols in Chesterfield whereby the ECC, the Emergency Communications Center, has a series of questions that they will ask anybody calling in for a 911 emergency. And based on the results of those questions, they may also indicate to our crews that they have a certain threshold that's been met that may be symptomatic of this particular disease. That gives our crews time to don their protective equipment. Thereby they will not be exposed, they will be less likely to be exposed by that patient. We have processes in place where they can decontaminate and get back in service fairly quickly and return to service. We've also been working through some contingency plans recently because you know, fire and EMS and public safety also has the potential to be impacted by this disease. You know, interactions on their days off even. And so we've worked through some scenarios whereby we would be able to operate with a reduced on-duty strength. And so I think that my partners here in the public safety community are all doing this sort of planning effort. And some things may change. The level of service that we're providing currently may have to be reduced. And in the concept of triage, we have to do the greatest good for the greatest number. And so we may be making some decisions and reducing some of that level of service that we would ordinarily provide to our communities to make sure that we are doing the greatest good for the greatest number.
Yeah. It was mentioned that there's, like many communities across the country, there's limited test kits available. How many do we have in our region right now? And is there a possibility that our own scientists in our own region are developing their own kits so that we can expand that?
So the state lab currently, as of yesterday, had capacity to test somewhere between 300 and 400 individuals. But as of a week ago, commercial testing through LabCorp and Quest Diagnostics has been made available to any healthcare provider who wants to pursue it. Now there are some just logistical challenges in that system. How quickly can they get access to the test kits that are distributed by LabCorp and Quest? What's the turnaround time on those tests? And so right now in the community, there are very few providers who are actually doing this. Part of our work as the Central Region Incident Management Team is to get the word out to those providers, to help support them in any way they can, and we probably need to do a better job of making the connection to LabCorp and Quest to increase the availability of testing, and then ensure that the public know, because one of the things that's been happening, I think that's been frustrating for a lot of individual patients, is not knowing where they can go to get tested, not being sick enough to show up to an ER, but maybe not, their provider not being able to provide the test. So I expect that to change very quickly. The second question you asked was, are we building internal capacity as a community to do this? I do not know the answer to that. I know that I talked to some colleagues at VCU yesterday who were considering adding this testing capacity to their in-house lab, but I don't know the current status of that.
Is there confidence that, any of us in this room, if I needed to go to my general practice physician for symptoms, would I be able to get a test?
Perhaps not today, but the hope is that by next week, most of the providers in the region will be up and running and be able to send off those tests.
Henry.
On the Hanover COVID case, doctor, could you talk at all about, have you guys isolated that incident in the sense that you've seen where this person has gone and have talked to who this person interacted with to make sure that there's no community spread from that Hanover case?
I'm not personally involved. My colleague, Tom Frank, who's the health director up in Chickahominy Health District, who's actually in Peninsula today because he's covering both districts and he's dealing with a significant, they had 2 reported cases yesterday. So I don't know the details around that investigation, but I know that Dr. Frank and the epidemiology team in Chickahominy are currently pursuing that. Oh, yeah.
I have talked extensively with Dr. Frank, and they have traced back the travels of that individual. That individual is isolated. He did that self-isolated when he came back, I believe, from Italy. And so that case is well within the purview of our health officials.
Yeah. One of the things that's worked well in China is the establishment of fever clinics. Is there any sort of similar advisement that you guys are giving to healthcare providers here? What kind of clinics? Fever clinics? Fever clinics.
The Central Incident Management Team is currently in the planning stage of doing more of a screening and testing clinic that health department staff and then some of our clinical partners might participate in. We've currently identified 2 potential locations to actually stand up an operation where we would do that. And we've done that because we recognize that there aren't a lot of opportunities right now to go and get tested. And a lot of our clinical providers, because of shortages of things like N95 masks, are wary about jumping into testing too quickly, because if their staff end up being exposed and they have to be self-isolated for 14 days, that's going to create an additional burden. So we are very much in the planning stages of that. We've identified locations. We are kind of working through the logistics and hoping that we could stand something up next week.
Alice.
I know that there is so much that we don't know about this, but I think the question on a lot of people's minds is, how long is this going to last? How long is this going to be a thing in our area? Is there any indication to show how long people, should be taking these steps? How long, as they plan out the rest of their year?
So as we've watched the epidemic curve in China, which is where this started back in early December, it seems like about 3 months is what it's taken to really get to the waning part of the curve. Korea is about 2 months, a little less into it, and they're just starting to see a drop-off in the number of daily cases. So if I had to guess based on that, I would say 2 to 3 months. But remember earlier I was talking about the importance of flattening that curve, which actually means we may have a longer period of time where we hopefully see lower level activity in our community. But 2 to 3 months would be a good guess at this point.
Couple more questions. Ken?
I know yesterday for Richmond DP, you said that they're not going to be shutting off water for the next 60 days. Is that something that's going to be taking place region-wide for things like water, and potentially, people can't go into work because their work is shut down, stopping evictions, things like that? Anyone address that?
I think everyone is looking at all options, including things like tax payments that are coming in. That'll be determined really as each locality goes through its individual budget. But it was a good first start by the city and the mayor.
Okay, thanks very much, guys.
Appreciate it. As well, I guess if no one else has another one, just in terms of as schools are closing, daycares may be closing, and especially for those kids who may rely on schools for their lunches, things like that. What steps are being taken by the cities and counties to help make sure? I know we've seen New Rochelle there with delivering food to home.
Yeah, I think yesterday we had a 4 o'clock press conference with schools, and Jason Cameras mentioned, our superintendent was with us today. He'll answer the question, but I think all of us are approaching this obviously with compassion as well, knowing that a number of our kids depend on their attendance at school. Sometimes they actually have a meal during the day, and so I think Richmond Public Schools, I know, is taking the lead on ensuring that our kids still get those meals. Mr. Cameras can talk a little bit further about the distribution points and things of that nature. Can Jason?
Thank you, Mayor. Yes, at Richmond Public Schools, we have established 20 of our schools as food distribution sites where we will offer shelf-stable meals from 9:30 a.m. to 12:30 p.m. Families can come to any of the sites. They do not need to go to their home school site to pick those up. We also are allowing families to take more than one meal at a time, so they do not need to come back every day of the week. We are also accessing a number of community partners who have offered to assist us with this. All of this information is on our website, rvaschools.net. And I know my colleagues in the counties are doing very similar things as well.
All right, last question. Yeah, just in terms of, I know private schools and child care facilities have, they have the right to make their own decisions, but is there any suggestions for them about how to proceed, similar to schools and so forth?
So some private schools have already decided to close. We've been in kind of constant conversation advising both child care centers and schools around this issue. The guidance, from CDC is fairly consistent. What we're trying to avoid is large gathering places where kids especially are going to do a lot of touching and transmission of disease. Again, not because kids will necessarily suffer severe consequences, because most kids have weathered this pretty well. But it's the spread in community and ultimately to older individuals or individuals with underlying health conditions that we're concerned about. So, those child care facilities and private schools are doing it on a case-by-case basis. We're encouraging them and providing the CDC guidance to follow suit.
Thank you very much for attending.
Thank you, everyone.
A reminder to stay in touch with the websites for the respective localities, as well as the state and CDC health sites.